United States. Despite the serious risks involved, it seems that a lot of people are just not up to date on their information as they should be. David Hansen is a doctor with Foxhall Internists and has some news about Diabetes Alert Day. Doctor, thank you very much for coming in.
Thanks for having me, Doug.
This is a disease which is exploding.
It's rampant at this point.
Is it all because of the obesity epidemic?
A large part of it, yes. And we used to say years ago that this was coming, that we were worried about diabetes and it was going to be a future health problem with increasing severity, and we've reached that point now. It's 1 in 10 Americans now have diabetes of some sort.
Let's talk about what happens when you have diabetes. What are the symptoms? What are the manifestations of it? What are the risks?
Well, the concern, and one of the reasons that we have Alert Day like today, is there are many people with diabetes who don't even know they have it, and some estimates up to 6 million people in the country right now. Some symptoms that you watch out for, though, are blurred vision, increase in thirst, increase in hunger, unexplained weight loss. Those are the big ones.
These are early symptoms.
Early symptoms, exactly. People who have a new diagnosis of diabetes, for instance, and no control of it, they may have those manifestations. But early on, you may not have any symptoms at all. It may just be elevated blood sugar doing damage to your system, and you may have no symptoms whatsoever.
And then later in life, and later in its manifestation, what are the problems associated with it?
Right. Well, left untreated over years, you can affect virtually every system. You affect the blood vessels, which supply the heart and the kidneys and the brain. You affect the nerves.
The extremities, obviously, because that's where we see a lot of amputations associated with diabetes.
The notorious thing, the diabetic neuropathy, you lose sensation in your feet. You lose the circulatory efficiency to your feet, leading to gangrene, leading to amputation. Literally, every system can potentially be affected, it turns out.
Let's talk about the different types of diabetes. That's something that always confuses me.
Right. Well, it used to be it was insulin dependent and non-insulin dependent, but now we have type 1 and type 2. Type 1 is typically children. That's when you have a lack of insulin and you need supplemental insulin to maintain your blood sugar. Type 2 is generally adulthood, and it used to be thought predominantly over age 45. Trouble now is we're seeing that earlier and earlier in life. We see it in teenagers, we see it in overweight teenagers, 14, 15 years old, which is relatively new in our history at this point. And it's related to diet, it's related to obesity, and that's a situation where you may not have sufficient insulin, but largely it's because you don't respond to the insulin properly.
And that's the canary in the coal mine about America's obesity epidemic.
Exactly.
This type 2 diabetes epidemic and this early onset. Back to type 1 again with the children. Is that inherited, or is it caused by diet or environmental factors? What?
Well, the genetic factors have much more prevalence with type 2, it turns out, that you can follow families through different generations, and several of them will have type 2 diabetes as time goes on. Type 1, not always, and it's sometimes an autoimmune process. You lose the ability to produce insulin in the pancreas, and that's not always a genetic factor. That's sometimes just random bad luck.
What kind of progress are we making in the treatment of diabetes?
Well, substantial, and that's really a point for today as well, that if you're identified early, you can make a huge difference in your outcomes over time. There are good control regimens. There are several medicines that we have now. It's not simply insulin anymore. You have several medicines to work with. And even over the last 10, 20 years, we have several more options as doctors to be treating people at this point. So really tremendous progress, I'd say. It's still a long way to go, of course.
And the standard treatment, again, is for people to adjust their insulin levels. Is that correct? With self-administered shots?
Exactly. With the type 1, absolutely. Type 1, you're completely lacking insulin, so you need the insulin shots. Advanced type 2, if you fail the standard oral medicines, then you get into the insulin. That's a later stage of process. But early on, if you're identified, let's say you are overweight, let's say you are inactive, can make a big difference with lifestyle modification, weight loss, exercise. Those are big things, and you can potentially put off medicine requirement for years by doing that.
This is a question, I suppose, that you're not often posed, but I'm very curious about this because over the years of my reporting, I've covered many accidents. And oftentimes, catastrophic accidents, car accidents oftentimes, where you'll hear the policeman in the aftermath say it, that the driver had some sort of a medical event. When I've talked to cops off the record, that usually translates into a diabetic shock or something to that effect. I remember covering one terrible accident where a guy went into shock, rear-ended a car, wiped out a whole family. With this epidemic continuing as it is this something that society needs to take greater precautions against?
Absolutely, because you have any number of things you can add to that list. You have risk on the road, you have individual risks, safety risks, you have healthcare expenditures, the list goes on and on. Apropos to your question, though, we have two situations there. We have a drop in blood sugar leading to hypoglycemia, potentially loss of consciousness, and that can happen at any time, including while driving. You have to be very careful about your insulin dosing. And the other is diabetes and other risk factors leading to heart disease and sudden death on the road, heart attacks and such. And that's often a cause of accidents as well. People have a sudden event and lose control.
Right. So. Which raises the question, should people be left to their own responsibility to administer the treatments?
Well, in some situations, no. In some advanced diabetes now, we have insulin pumps, which largely take that voluntary aspect away. The pump does a lot of it automatically, checks the sugar, administers the insulin, it's all internal, and it takes some aspect of insulin control out of the hands of the patient. Yeah.
Peer into your crystal ball 10, 20 years down the road about the manifestation of this epidemic of diabetes, what we're going to be seeing down the road, both in terms of the troubles that it causes for our society and also in the progress of treatment.
Exactly. Well, I think the concern now is the trend we're on, it's going to get worse and worse. The numbers are going to get higher and higher. We've already seen a tremendous increase over the last generation. And left untreated, without interventions for childhood obesity, adult obesity for that matter, you're going to see numbers go up and up. Right now, it's 1 in 10 Americans. 1 in 5 are thought to be at risk, and those ratios are going to get smaller and smaller over the next generation. But it's a treatable situation, excuse me, that you can make a difference in your lifestyle, can make a difference in your weight and your exercise program. Definitely early screening makes a big difference here. Seeing your doctor, there are other means of screening that you can do, local community health services and such, and that can make all the difference.
Yeah. Dr. David Hansen, Foxhall Internist, thank you so much.